Hello, everyone. I'm here with Shanetha Lewis, and we were just talking at the end of the week about veterans issues and thought this would be a great time just to spend a few minutes and share our conversation. Welcome, Shanetha,
Thank you for having me today.
and the organization as our ally in medical cannabis issues. And I think we see veterans get mentioned as a talking point all the time when it comes to medical cannabis
Mhm.
issues. And I think something you and I have talked a lot about is that people often use veterans as a bullet point more than an ally. A question that kind of comes up every Veterans Day that is a little off topic, but is it appropriate to say Happy Veterans Day? I mean, how do you talk about Veterans Day?
So it is. It's not like Memorial Day. Veterans Day is a day that we take to reflect and honor those who have served, who have previously served in the armed forces. Is it appropriate? Absolutely. It tends to go like one service member to another. When we're speaking to one another, we
Uh-huh.
say Happy Veterans Day battle or Happy Veterans Day buddy. But if you're speaking, if a civilian is speaking to a former service member, a veteran, they tend to say thank you for your service. I genuinely appreciate it. I thank and I'm grateful for anyone who speaks to me and says thank you or thank you for your service or happy Veterans Day. Some veterans do get uncomfortable, especially those who have seen combat. They don't want to reflect on their service, so they may get a little bit uncomfortable, especially if it's in a public setting. Personally, I don't mind, and there's nothing inappropriate about saying thank you or happy Veterans Day.
Thank you for that. I appreciate that. I
Thank you for
think
your
that,
support. We appreciate it.
and thank you for your service.
Thank you. I
Yeah, I
appreciate
think I see, Veterans Day, you see icons all the time that kind of just come up that when it's on the calendar that you see like Ford Chevrolet, happy Veterans Day, right? So
it.
I've always wondered. So thank you for that. But I think, kind of digging into issues around medical cannabis, I wonder if you could just share a little bit with our members, what are some of the issues that are facing veterans when it comes to medical cannabis. Again, we see veterans added as a bullet point, but I don't think people appreciate necessarily what a different experience veterans have than civilians.
So when it comes to veterans, number one issue that we're facing is safe and affordable access across the board, across the United States. So, of course, right now we have 38 states that have legalized medical cannabis. But if we don't have all 50 states, then we have veterans that are in places where they don't have access to medical cannabis. And even if a veteran lives in a legal state, since the VA is mandated by government, by federal law, it's a government facility. Your VA healthcare providers, although we've made a lot of progress in the last couple of years, there's still a gap there. Your VA healthcare providers cannot recommend prescribe cannabis. They will also not distribute or administer cannabis. You can also not be repaid or reimbursed for any cost that you have incurred getting cannabis, whether it's your doctor's visit with a doctor outside the VA healthcare program, or any of your cannabis products. So, as we know, many veterans, especially disabled veterans, are on a fixed income. Therefore, they sometimes don't have the means in order to get their cannabis, to have their visit with their doctor, or to get their medical cannabis products. So that's the two biggest issues that we're facing. And then there's also another population that people don't tend to think about as much, but we have veterans that live in government housing. And so, because again, it is mandated by federal law, they are not allowed to use cannabis. And I don't mean sparking up in their living room. I mean, they cannot have a tincture in their own home. And if they bring this tincture or any cannabis product onto federal property, it's against the law and they can lose their housing. So that's usually a topic that most people don't really think of, and that escapes the forefront of their mind when addressing veterans issues when it comes to medical cannabis, and that's definitely a big one. We also have that if veterans get hospitalized or need treatment where they're in a hospital. Same thing. They can not take their cannabis medication anywhere on VA property. So if they're getting any sort of surgery, they cannot use their cannabis medicine. And that is an issue. It stops some veterans from seeking treatment, and it stops them from getting surgeries. I've seen it. They refuse to go. If they can't have their cannabis, they won't go. They'd rather have cannabis than opioids, and I can't blame them for that.
Yeah, no, thank you for that. There's a lot of the same issues in some sense that are facing most patients in the United States, but I think that the other layers of that, as far as where, veterans health is not it's not a specialty service. It's something that our veterans have earned, right? At the very least, right? We should be able to survive, to provide health care for our veterans. And I think, on Capitol Hill, we've seen, some members of Congress kind of pull out veterans issues and try to pass little segmented pieces of legislation to help veterans. But as you pointed out, even if you make it legal for the doctors within the VA to write recommendations, unless it is federally legal, right? The veterans are going to face the same issues that other patients face about bringing into hospitals, using subsidized housing, etc. So, and you just joined us on our last couple lobby days in DC, and I know one of the things that we were hearing from members, whether from veterans perspective or just patients perspective, is that most members of Congress seem to think that either the adult use and hemp markets are taking care of patients, so there's no need to move forward any of that agenda, or that Schedule 3 is going to somehow make medical cannabis available to everyone. And so I wonder if you can address some of those issues for veterans. I know you were actually going to be testifying at the rescheduling hearing, so congratulations. But
oh, thank you. Thank you. I'm very honored to be that Veterans Initiative 22 was selected, and for me to be representing Veterans Initiative 22 at that hearing. I'm quite nervous, but excited very much for this opportunity and to be the voice of veterans and to represent my community. So to go back to your question, one thing that's a little bit frustrating for sure is that they believe adult use is, oh, well, you have adult use. What more is there to worry about? Now anybody can buy it if you're over 21. No, it's actually, it's kind of done the opposite. Although, again, I am thankful for any progress when it comes to access, when it comes to patient access. We've seen that their patients are actually being left out of these programs. Even here in Maryland, sadly, they have taken away the clinical director mandate. So our dispensaries are no longer mandated to have a clinical director there. And as we know, cannabis has been legalized state by state by patients and for patients. And so for them to now be left out of these conversations, or for our leadership to believe that everybody's taken care of, is very much far from the truth. And we're actually seeing patients being left behind and being left out of these programs. And although, like in Maryland, it's lower taxes, they have priority in lines, there's no clinical director there. So if we have a real patient come in and want to talk to somebody that has a degree like myself in medical cannabis science and therapeutics, or a nurse or a doctor who's well versed in cannabinoid science and therapeutics, that they don't have that there. And no offense to bud tenders, been one, been there, but when we're dealing with patients, especially a very vulnerable population such as veterans, they need to speak to medical professionals, and they need to be at the forefront of our minds when we're putting together policy and legislation when it comes to cannabis, not in the background, at the forefront. And what we're seeing now is us being pushed to the background. And it's something I didn't actually expect. I was very much, adult use in Maryland, I was like, let's go. But now I'm seeing these gaps in these issues. We're seeing issues with finding products. A big one is lower THC products, because of course they're not as profitable, we're not seeing them on the shelves. Our patients need lower THC products, especially those who have been cannabis naive their whole lives, when we're dealing with an older veteran population, or just a veteran who's never used cannabis. So, seeing that this product availability is lacking, seeing that patients are again in the background and not at the forefront is a major issue, and one that we're advocating against here at Veterans Initiative 22.
Companies kind of hiding behind veterans and saying, no, they're going to be protected under hemp only, or they'll be protected under adult use only. And so, I really appreciated being able to work with Veterans Initiative 22 and yourself, and really making sure, as we're looking at federal solutions, that everyone is at the table. This is something that we've always talked about at Americans for Safe Access, and that part of being a coalition, part of bringing people together, is that you're never working for people, right? We're not working for veterans, we're working with veterans. And the only way that we can do that is that if veterans truly have a seat at the table. So we've appreciated your input in both our legislation and in our campaigns. And I know there is one thing that both of our organizations have been trying to bring forward for veterans to participate in more research. And I'm wondering if you can tell folks about this study and how to get involved.
So I'm very, very excited about this study. And although Veterans Initiative 22 isn't a formal sponsor, we absolutely support this study. We not only support it, we're also a part of it. Two of our executive board members, myself and Renee Reisinger, are part of the team, are part of the research team. Renee is actually the lead investigator on the in the research study. I'm very proud of that. Renee. And I am a co-investigator. And so what we've done is we've linked up with the Connor Sheffield Foundation and Tetragram, and they put together this awesome observational study. And you're going to be doing it through the Tetragram app. It's very, very easy. It's just a survey for PTSD and cannabis usage. Very easy through the app. You just enter information at time intervals. And what we're going to do with this information is we're sending it up. It's all formal. We've been IRB approved, and we want to use this information to help extend the knowledge about PTSD and cannabis. So it's not only just for veterans. Anybody that has been diagnosed with PTSD or feels that they have PTSD can participate in this study. So we definitely encourage anyone who has PTSD, who's been formally diagnosed or believes that they have PTSD, to come and partake. Super easy. It's not overly, it's literally just through the app. There's no coming in, no blood draws, no anything like that, just informational, all through an app. Very easy. We would love your support, and we appreciate you sharing this with everyone. Steph, for sure, it will definitely make a difference.
Wondering what's happening post-election. So I just want to invite folks to sign up with Americans for Safe Access to get alerts about things to be doing in the lame duck, as well as getting prepared for the new administration touch. And know that as we are going into this, the 119th Congress, that there's a lot that's going to be happening. Veterans and patients have this issue that people often try to speak on our behalf. And so I just, if you hear that there's a piece of legislation coming up, you can't just assume that it's going to help patients or veterans. You should really ask organizations that are representing veterans and patients if it will in fact be helpful. And so I'd say just stay tuned in. And again, I want to thank Shanetha for spending some time with us today and bringing some of this perspective of veterans to all of our members. So thank you.
No, thank you, Steph. Thank you for having me today. Thank you for reinvigorating our sponsorship of one another. I look forward very much to this next year and us really, really pushing veterans issues to the forefront and doing that together. And thank you for all you've done throughout these many, many years for patients. Without you, I wouldn't be here. So thank you for all you do.
Thank you. And thank you for inspiring so many people, Shanetha. We really appreciate it. All right. That is the last of this little update. And hopefully we'll have Shanetha on here more. So have a happy Veterans Day.